It is my pleasure to join you for Health Connect South and open today's session on the role of connections and collaboration in healthcare. Indeed, this is a principle we apply daily in the world of public health. The connections and collaborations of our communities, institutions, and organizations are essential to accomplish our mission of having all people live healthier lives. You know this. You, as regional health leaders and innovators, have long recognized the need to create successful cross-industry partnerships. Your dedicated efforts have revealed many combined strengths and new opportunities for coordination and achieved meaningful results. Here in Metro Atlanta, 11 universities and hospitals have partnered to develop better healthcare treatments, conduct research, and develop new ventures. A thriving partnership between clinical experts from the Pediatric Technology Center at Children's Healthcare of Atlanta and Georgia Tech scientists and engineers created a new field of study to adapt medical devices, tools, and medicines for pediatric use, since children's bodies may respond differently to adult medicine practices. Another exciting development is the new Global Health Crisis Coordination Center in Atlanta, created by a coalition including the Metro Atlanta Chamber, Emory University, and Georgia Tech, and funded by a $1 million grant from the CDC Foundation and Microsoft. The center will connect academic, healthcare, and business groups in public health and further fortify Atlanta's role as a global public health hub. And who could forget Emory University's Vaccine Center, conducting clinical trials as a part of Operation Warp Speed to test potential COVID vaccines. Its Hope Clinic, in partnership with the University of Georgia's Vaccine Center, was one of the premier labs to verify the efficacy of several leading vaccines. Thank you to all of you for your continued commitment to develop truly innovative and beneficial partnerships that serve the greater good for all people and communities across the Southeast. I look forward to hearing what is working and what might be improved, where you see good models of collaboration and coordination, and where there are challenges. Please consider me and CDC your partner in this journey. I'd also challenge each of you to explore how you and your organizations can explore partnership opportunities to help advance health together. And with that, I turn it over to Dr. Howery and Mr. Rubinger to continue the conversation.
Thank you, Dr. Walensky and Mr. Rubinger. That was a little formal. Dr. Howery, it's very formal, but we appreciate that, and we want to thank the director for her remarks, and I want to welcome Dr. Howery to the stage. I'm David Rubinger, market president and publisher of the Atlanta Business Chronicle, and I'm very happy to be back with you once again to be part of this session where this is what we do at the Chronicle all the time, trying to find these great interconnections between business and our communities in general, and this today talking about public health. Dr. Howery, thank you for being part of this. Dr. Howery serves as the acting principal deputy director of the CDC. As the director of the National Center for Injury Prevention and Control, Dr. Howery leads innovative research and science-based programs to prevent injuries, overdose, and violence, and to reduce their consequences. But more importantly, not more importantly, but equally importantly, she's the deputy director, the acting deputy director for the CDC. So as we were discussing before, if Dr. Walensky's not, well, Dr. Walensky might be talking about monkeypox or COVID, everything else falls on her. So it's great to have you, and as you heard from her background, Dr. Howery is trained as an ER doc. So I have to ask first thing, do you miss being in the emergency room versus, I don't know, dealing with the emergencies that go on at the CDC?
Honestly, it probably depends on the day, but there will always be a place in my heart for Grady. I spent over 15 years in the ER there, and I still try to practice clinically. When I first came to CDC, I did still do a few shifts in the ER, but found it was hard to keep up that clinical competency, with technical skills like that. So started working in a substance use clinic and have been able to do that throughout the pandemic. Not while I've been in this role, but I always think it's so important to still see patients and to really have that connection with people.
So the purpose of this discussion is to talk about a lot of things, but I think given this audience, I think everyone would like to hear a little bit more about how things are going at the CDC. I mean, it's only been about a month since Dr. Walensky announced the changes that were going to be coming to the CDC to modernize public health, including the reorganization. So how do we modernize public health? I mean, that seems like a pretty gargantuan task.
It is a gargantuan task, but I think during COVID, we've learned, a lot of things need to change. When you look at CDC, we've grown. We've had so many new programs, data comes in faster, and we've seen so many emerging health threats 24/7. So we knew it was time to take a step. How do we look forward? How are we proactive? And how are we that public health organization that the public can count on? And really looking at things, like you said, data modernization. How do we have a diverse workforce? How do we ensure we're able to communicate quickly and reliably to the public?
So where are we at this process? So tell me where we are. I mean, because really, so much has to get
Yes.
done. So tell me about the first steps that you've been taking so far.
There's been a few things, and this is very timely. I was literally doing a webinar this morning, live for CDC, with the latest updates. Earlier this spring, there were 2 concurrent reviews that happened. One was an outside consultant, Jim McCrae, looked at what were lessons learned during COVID, really around some of our science, our policy, things we could do differently in the future. Then myself, Sherry Berger, our Chief of Staff, and Robin Bailey, our Chief Operating Officer, interviewed other centers, stakeholders, staff, to just think about as we grow CDC, as we change CDC, as we're more responsive, what are things we need to consider? We put those together, presented to the director who gave some initial recommendations, but we wanted to engage staff. So we now have 10 strike teams focused on a range of issues from global health, data modernization, response, and we're now looking to make concrete recommendations for some structural changes, but also systems and processes, because we know that moving boxes is not enough. We have to make sure that people are engaged, people are leaning in, and people are part of the process.
So I've gone through reorgs before, and it's sometimes the most fascinating part of it can be talking to the people. So give me an example of some of the takeaways you got when you were talking to staff about things that you need to be changed. Was there anything memorable that stuck out as you were doing this that maybe you didn't even realize when you were going into the process?
A couple of things, and one was just from hearing from partners about how difficult it can be now to navigate CDC. I heard from one grantee who literally had like 7 different points of contact at CDC because of the different disease entities they were focusing on, and during the emergency, how difficult it was to apply for multiple streams of funding. And then on the flip side, I heard from many people, well, why don't you just share data faster? And a lot of people don't understand that we can't if we don't have access to the data, and there's data authority issues to where a lot of times with different diseases, when it's not a public health emergency, we rely on voluntary sharing of data. So looking for things like that we can overcome.
So what do you think are going to be the keys? What is it going to take for, I don't know what do you consider to be the finish line, I guess? How do you reach the finish line, and what does it look like, and what are going to be the keys to the successful reorganization plan?
I don't think there will ever be a finish line because we will always be constantly improving and changing, but for this stage, there will be a finish line, and the plan is to submit a reorganization packet by end of the calendar year.
Yep.
And we've already made some initial decisions like elevating the Office of Science and our laboratory work back to the Office of the Director, and creating a new Office of Equity so we can really look at our diversity, equity, and inclusion across the agency, but also in our programs. And then looking at how we can have more of a response-ready workforce. So those are things I know will be in place, but we'll go through these strike teams, engage staff, and have a new packet by December.
I feel like every year we come back to this forum, the discussion is CDC does so much more than simply talk about COVID. I mean, that's really, unfortunately for Dr. Walensky, this brilliant woman is always being put on the spotlight around just about the COVID issue when there's so many.
Monkeypox now too.
And now we get to add monkeypox to the mix. Again, since your area is beyond I mean, obviously you oversee it all, but your personal area is over the other things. Aside from the common report on diseases, what are the other trends that you're seeing at CDC that you feel like you need to be focusing your personal attention on, and what the organization needs to be focusing on?
I think a lot of these issues were pre-pandemic, and we've seen them worsen during the pandemic. And examples, drug overdoses. We know those went up about 15% in the past year.
Yep.
A lot of it's driven by fentanyl. So at CDC, we're looking at things around harm reduction, like fentanyl test strips, and connecting to certain service programs, because we know we have to focus on prevention, but also recovery and response. You look at firearm violence, and CDC published the first ever vital signs. That's our signature publication this year. And it showed really big racial inequities in firearms, with African American males between 10 to 24 being over 20 times more likely to die from firearm homicide than their white counterparts. So looking at what we can do early on in those building blocks in life to prevent childhood trauma, ensure equal access to education and healthcare are really important, and to prevent community violence more broadly. Dr. Ford mentioned maternal health. We see 700 unnecessary maternal deaths a year, again with racial disparities. And CDC now has Hear Her campaign to make sure that women are being listened to about their own bodies and their concerns. We've seen mental health distress during this pandemic also worsen. Suicide continues to be a leading cause of death, and there's so much we can do to prevent it by building resiliency, looking at communities on how we can really provide those gatekeeper trainings to identify those at risk, and refer for treatment, and ensure that we do have good connectedness. I'm an optimist, that's how I sleep at night, but I think we have to work together as a community to address all these other issues that are not getting better.
So you have this audience here. You from inside the walls of the CDC, there's only so much you could do, which is why engaging with this community is so important. What are the things that healthcare professionals do best to prepare for, I mean, we're gonna have other public health threats going forward. What are the best ways for them to engage and understand all these things? And before I go on, guys, I can't see a time clock, so I just wanted to know where I am
Well,
on
I gotta
time.
watch.
Oh, gotta watch?
12:30.
Okay, so I just want to make sure, thank you. I just didn't want to go over my time, so I just want to make sure we're on the right schedule. So, but back to the question, what can this community do to engage in an appropriate way?
So you all are on the ground. We really rely and value your partnership. That's part of the reason why I do my best to try to continue clinical practice, so I still have a toe on the ground. To prepare for public health threats in the future, the best thing we can do is to always be prepared. I know in the ER, one of the things we did were a lot of risk assessments all the time, and we would do different exercises. So should there be unfortunately like a mass shooting or something coming in, or an earthquake, we knew how to respond. It's also important to be up to date on the latest clinical guidance. That way you're always able to respond for patients. I like to always try to merge public health in that, though, too. How do you, look at the longer-term issues? So is your patient up to date on their vaccinations? Is their hypertension and diabetes under control? So when one of these infectious disease threats does hit, these are the patients who are going to be more vulnerable to severe illnesses. So how are you preventing them from having those consequences? And then how are you going to respond to a surge? Do you have the appropriate staffing capacity? And can you take care of one another? Certainly, everybody in this room has probably felt the pandemic really hard. And I know there's been a lot of distress, burnout, fatigue among the healthcare workers. So does your system now have a place where you can build that resiliency, build that support, allow some of that time off and that surge?
Okay, so the issue really becomes, and it's one of the things you're working on with the reorg, is the best way for this to communicate with CDC. Because that was one of the things you heard is, who do I go to? How do I get there? So right now, I know while you're sort of like putting fresh tires on a Maserati at 180 miles per hour, but what is the best way for people to connect with the CDC now? How do your partners best work with you?
So there's a few ways, and in the future, one of the things we're looking forward to is really having this front door, and that will be an Office of External Affairs. So if you haven't connected with CDC before, it's like a one-stop shop. You reach out and we will connect you to the appropriate subject matter experts or centers. Otherwise, on our website, we've got different points of contact. We've got CDC info if you have questions. I also think things like the health advisory notices are so important to sign up for. That's where, when we've seen a foodborne illness, like when we saw polio come out, we're able to communicate with clinicians quickly. We also have the CDC Foundation, wonderful way to partner with the foundation within the community. And then I'd say also anytime you need technical assistance, you can reach out through your state health department or to us, and we'll come out.
So what are the best ways so public health and healthcare sometimes have been on, I won't say opposite sides of the street, but sometimes they've been working, trying to reach the same goals, but operating on separate paths. What are the best ways do you see the public health community and the private healthcare community integrating better? And you've talked about some of them, but are there other examples where it works best?
And it's so interesting for me because I got my MD and my MPH at the same time. So for me, they've always been linked, and I just view it as a spectrum.
Right.
And I think public health is healthcare, and healthcare is public health. I think there's so many opportunities that when you see that patient or that person in front of you, to take a step back and figure out what else is going on. So I think about the patient I'd seen with a skincare infection. It was from IV drug use. So did we talk about linking for medication-assisted treatment? Did we talk about naloxone to prevent that drug overdose? There's been some great examples in the community here around monkeypox. You know, we partnered with Georgia Pride Day, you know, and gave out monkeypox vaccinations. So looking for ways that we can merge that healthcare and public health. I think, again, looking for ways for prevention, so making sure vaccines are up to date, diabetes, high blood pressure under control.
So you brought up a lot of things. The toughest one I think you would have to deal with in your world is what we all get very frustrated by, and that's misinformation that gets fed into the system. Because here you are going down a path for success, and a tweet can throw everything off course. It's because it's amazing how we gather our information through all these different channels. How does the CDC hope to combat misinformation? How can we all combat misinformation? Are there any tricks that you've learned over the years that you think help at least lessen the burden of bad information making it into the hands of the people?
Great question, and I think we've all seen it. And unfortunately, it has consequences, like real consequences for people, and can result in deaths and, you know, mistreatment. This is where we really need all of you. You know, what I would say is CDC can continue to provide timely and reliable information, and we will do that. We'll look for other venues to do it. What we found, though, is trusted messengers are where it's so important, and our partners are. So whether it's the healthcare system talking about the patients and the volume they're seeing, really, again, promoting what the science shows, what you can do about it, but then partnering, too, with communities. We've seen churches, different organizations. They work with their community really well, and I've seen that, like, if you can make those connections with people and help dispel that misinformation, really important. So I think if we all work together to continue to share consistent, reliable, and scientifically based information, and for me, that's what it is. It's not being political. It's not having a view. It's sharing what the science and the data shows to save lives.
And I guess that extends, the one you talked about, churches and other community groups. Let's talk about the roles that businesses can do for their employee base to address public health care issues. That may include some of helping address the misinformation things. Where have you seen the best places where the business community, I care about the business community, where they best intersect with public health officials towards achieving goals for their employees? Because frankly, that's how we keep our economy going, is to have a healthy employee base.
The businesses that I have seen that have done this well are those that have that holistic approach.
Right.
So that those that will allow their staff during the day to go get mental health therapy as needed, or substance use treatment. Sometimes there's stigma around that, and it's difficult to go after hours or on weekends for many of these clinics, so making sure that's supported. Simple things like having flu vaccines or health days at larger businesses is helpful, because that, again, promotes the healthy business. Making sure employees have accessible health care,
Right.
both affordable and truly accessible. And then making sure there's flexible work schedules, time off for those 6 days, really supporting that is important.
So I think it's one of the things that came out of COVID that was one of the good things, if there's something good, is the fact that I feel like insurance companies, the benefits providers and the companies have gotten much more on board with finding ways to connect with their employee base towards keeping them healthy, whether it's through telemedicine, through mental health. There just seems to be a renewed focus on finding ways to keep people healthy, keep them well, even during a pandemic. And now, even coming out of the pandemic, those programs don't seem to be going away.
And I hope they don't, because that builds, resiliency, promotes long-term health, and is a benefit to both the employee and the business.
Very true. I'm going to take you back to the beginning. We talked about how you worked in the world of trauma medicine and emergency medicine. And for those of you from Atlanta, of course, the headline has been about Atlanta Medical Center. I'm not going to go into the politics of it, about good, bad, or indifferent. I think we all agree that losing a hospital is terrible. But I think the bigger question I have for you, as someone who's looked at this on a global stage, have you seen places where urban communities have been able to support their communities, having only one true trauma, state level 1 trauma center. How does that work? Help us look into the future about what this could look like if we're down to Grady. But what else? How do you see that playing out?
So a lot of it depends on what are the other trauma care systems nearby, like if there's level 2 or level 3, and how far away is that other level 1. And for me, it's about what happens when it's not a regular day. On a regular day, most hospital systems could, address it. I think during the height of COVID, when we had critically ill patients in the emergency departments and in the hospitals, then it was difficult to handle any surge of trauma or anything like that. So that's when I think it's an issue, in particular for cities that don't have as robust of a healthcare system. Certainly, Atlanta is resilient and flexible, and Grady has tremendous capacity, but for me, it's what happens on the days that aren't normal.
Well, let's hope that days stay as normal as possible as we go through that.
Because that always happens, right?
Yeah, right, exactly. Nothing ever changes. So our getaway question, anyone have heard me do interviews before, I always ask this because it's all about the great crystal ball. If you had a crystal ball and you could look at public health in a 3 to 5 year landscape, what are the kind of things you'd like to see accomplished that would make us, when we get together, we say, look what we're able to get done that we didn't think we'd be able to get done? What are those things that are out there in the future for you?
I want to see CDC's household name restored. I want public trust back to where it was and even greater. CDC is there 24/7 to protect the public. I also know that now, as we're thinking about where this reorg can take us, having world-class data analytics is so important. Improving our lab capacity, critical. And really focusing on a diverse workforce, not just within CDC, but in the populations we serve. That's what I want to see, so that we are poised to respond to any threat that there is, and working with this group and other communities to respond quickly and nimbly.
Well, there are a lot of patients out there who are probably really upset that they don't have you as their doctor when they go into the ER. I think we are really lucky to have you at the CDC overseeing all of this. On behalf of Health Connect South, let's thank Dr. Howery for joining us today. And with that, I think I'm going to turn it back over to Russ, I believe, for our next session. And I think I caught him off guard as he comes on. So
we made it on time.
I know. I was going to say. Russ, do we need to tell any jokes or anything? Do you need? No. Get up here. Oh, Dad! No dad jokes coming from me. I'll get banished. All right. Thank you. All right. Thanks, everybody.
Dr. Howery, David, thank you both very much. David has been, I'm going to embarrass him for a second. He has been incredible as a partner to us and in doing this year after year. Dr. Howery herself is an alumnus of Health Connect South and has been here before. And to each of you, thank you very much. This is always a highlight for us. And to Dr. Walensky, please give her our thanks, and we really appreciate it.
Thanks.
Okay, awesome.